Hey there, guys and gals of Mazske Finance World. How you doing on this outstanding, terrific Tuesday? It's June the, hang on, it's Tuesday, June 14th, year 2024. I'm going to talk about health insurance for early retirees. Now, with that being said, I'm not a financial advisor, not a CPA, not an attorney. I am not a doctor, not a nutritionist, okay? But have you thought about this? If you are an American or you live somewhere else in the world, what are you going to do for health insurance if you retire at a younger age than most other people? Because what is health insurance? I use the United States as an example. Where do you get your health insurance from? Almost everybody gets it from their job, right? Why? Why is health insurance in the U.S. tied to your job? Yes, you can get it on your own, but it's more costly, right? That's why we get it with our employer. But shouldn't it be better if somehow it could be separated from our job? Okay, so if you're an early retiree, guess what? You're separated from your job. You got to think about that. All right, have you thought about it? All right, so that being said, as a precursor to health insurance, and I'm going to tell you some actual rates that I have found out for covering me and the missus here in Panama, and if we travel around the world. Okay, and I'm waiting for a reply on something, so if I look down at my other phone at some point, which is in my pocket, that's what I'm doing. I'm checking to see if I got a reply from my health insurance guru person I'm using, okay, for quotes. So anyway, with that being said, a precursor, where's my green tea? Green tea is healthy, okay? As a precursor to retiring young, get yourself as healthy as you can. Green tea is healthy, coffee is healthy. Fruits, vegetables, nuts, seeds, legumes, mushrooms, herbs, spices. All right. Where do you like me better in my condo to make videos? How's that for a background? Let's see. Make sure I don't trip over something walking backwards. That's some nice pictures behind me. That's an option. Or if I go out on my balcony, see, it's an option on my balcony is you look down at the ocean, but then sometimes there's a glare, depends on where the sun is. Okay, you can see the ocean, or I can go out on the front side, and I'll do that. But then I'll get back to talking about actual rates of health insurance as I found them out. And I'll give you options from the U.S., because I used to live in the state of Florida when I was retired. All right, let me walk out here real quick. All right, there is a view from my front porch, shall we say. All right, I'm gonna go back into my condo here and sit down where I got my notes typed up. But live as healthy as you can. Eat healthy, exercise, minimize stress, sleep well, and minimize external trauma. What do I mean by that? It means if you're in a car, wear your seatbelt. If you're riding a motorcycle, wear a helmet. If you're thinking about going out to your local club tonight, limit the amount of alcohol you drink. Do you smoke? Do you vape? Do you dip? Do you chew? Quit it. Do you use illegal drugs? Stop. All right. So anyway, health insurance. Let me get into the rates, okay? Real quick though, I'm going to give you an example from the U.S. When I worked a job as a police officer, health insurance was expensive. I didn't make a lot of money. There was times I was paying $300, $400 a month for family coverage, and I didn't make a lot of money, so it was expensive. But anyway, when I retired, I moved to Florida. I found out in Florida, getting insurance of my own, they had Obamacare, and it was subsidized, my health insurance. My health insurance for me and the missus was over $1,000 a month, $1,200 a month, $1,400 a month, but it was subsidized, and maybe I paid $335 a month, because I did pay that much for a period of time. But then, in the year 2022, I think it was, yes, I withdrew a bunch of money from my wife's 401k, like roughly $200,000. And I never thought about it, but it was tacked on to my taxable income for the year. And even though I paid federal and state tax, I withheld that. That was all fine. The problem was the subsidy for the health insurance is based on your income. So when my taxes were submitted in 2023, months had gone by, I got a notice that I'd have to reimburse, or I owed all my taxes, this subsidy, okay, of about $1,000 a month that I had gotten, for the entire year almost. So I had to pay it all back. Okay, I had to pay it all back. So anyway, think about that. Because if you plan to not get a subsidy, because if you're early retired, hopefully you got a high income anyway, what are you going to pay? $1,000 a month, $1,200 a month, $1,400 a month, $2,000 a month just for health insurance? Okay? So anyway, I am now living in the country of Panama. A lot of Americans or expats, Canadians, Europeans in Panama go without insurance. Okay? Panamanian healthcare is much cheaper than in the United States. Okay? You can go to the doctor many times for certain doctors, $5, $3, $15. You can get a prescription, perhaps, depends on the medication, for $5, $10, $15, something like that. Okay? I had a ear infection at one point months ago. I went to the doctor. My doctor's visit was like $15 for the doctor's visit. My prescription, the drops, $5 and some cents, I think it was. So, and I've known of Americans who have, I've heard about Americans or Canadians, I don't know what they were, who had a heart attack while they were on a tour here in Panama, and one person needed a heart surgery, and it's going to be roughly $25,000, which is cheaper than the U.S. But they required to be paid up front. They did not have insurance that would cover them in Panama. They were here on a tour. And so they had to put it on their credit cards, and they had to get a variety of credit cards to get up to a $25,000 max, so they could pay the bill. Because the one, I think it was a guy, needed emergency heart surgery. I know another young man that was in Panama and got sick. He had to go to the hospital. I forget his actual price. He has a little bit of money. He's an investor, but it was much, much cheaper than it would be in the United States. So he just paid it out of pocket. All right. So anyway, with that being said, some actual prices here on health insurance. All right. If I get Panama-specific health insurance, which covers me in Panama and also in Colombia and also in, I think, Costa Rica and maybe one other country, just local countries, okay? And this is for the missus and myself. I have a choice of a $1,000 deductible, a $2,500 deductible, a $5,000 deductible. Obviously, the higher deductible you get, the lower the price is. So with those three ranges, and I keep getting phone calls coming in on WhatsApp on this phone, so it keeps popping up there. Anyway, so anyway, those prices are $1,000 deductible just for Panama-specific health insurance, which is, I'm not going to get into the coverage because, insurance. All of you work different jobs, have different insurance. Every plan is different. They cover this, they don't cover that, so on and so on and so on. Okay? But in Panama, just know care in general is much cheaper than in the U.S. But anyway, annual price for health insurance in Panama, $1,000 deductible, $795.89. Two people, annual cost. Divide that by 12 for a monthly cost. $2,500 deductible for country of Panama, Costa Rica, Colombia, like around there. $2,500 deductible, annual cost $634.29. Cheaper. $5,000 deductible for here in Panama, Colombia, Costa Rica. And it may cover a fourth country. $5,000 deductible, annual cost is $476.35 for two people. We're both in our 50s, okay, our mid to late 50s. All right, so the older you get, the more expensive it may be. The younger you are, maybe it's cheaper. If you have kids, I don't know. I don't have, my kids grown. All right, but if you figure if I was planning to stay here in Panama and do minimal travel, like to Colombia or something like that, I could be covered for a year for, bad stuff. Say I get in a car accident, I get T-boned, and me and the missus get hurt. Okay, $476 a year. Pretty good deal, right? It's a lot cheaper than the U.S. All right, but then I was like, what if I travel to the U.S.? What if I travel to Europe? What if I go to Asia on vacation? What if something happens? Because you never know what may happen, right? So there is a company here I can get insurance through. I don't know if it's based in Panama or not, but it gives me global coverage. Okay, it's for emergencies only. It doesn't cover routine care, and that's what I would use the Panama insurance for: emergencies only, not routine care. All right, this one, same deal: $1,000 deductible, $2,500, $5,000 deductible. As far as I know, there may be a limit on some country, like maybe I can't go to North Korea as an example. But if I was to get this is much more expensive. Annual cost for two people, husband and wife, both in their mid to late 50s, $1,000 deductible, $7,941.80. Okay, divide that by 12. So it's not $1,000 a month, but it's expensive. $2,500 deductible. Annual cost is $6,227. So that's $500 some dollars a month for, yeah, roughly that, $500 some dollars a month for the world, for insurance for the world. $5,000 deductible, $4,890.86. Okay, so less than $5,000, and I can have insurance that will cover me anywhere in the world, but it's not for routine care. Okay, if something bad happens, it exceeds $5,000. Okay, then I have coverage. That's not a bad deal. However, as of this moment, I am not a global traveler. I am planning a trip to the U.S. later this year. I've already been to the U.S. once this year. I was not covered in the U.S. when I was there. Okay, fortunately, nothing happened. I'm planning another trip to the U.S. I'm also planning to go down to Colombia. Okay, and that might be it for this year. That might be it, unless I make another trip to the U.S. or make a second trip to Colombia. Okay, if I go to Colombia, no big deal. If I go to the U.S., I need another care. But anyway, I then asked my contact. That's why I'm waiting for another reply back on what if I get the Panama only insurance, and then when I take a trip, I get kind of like traveler's insurance for that trip. And I know there's other options out there for you guys. Maybe you live somewhere else. I live in Panama. My option here in Panama, let me set this cup of tea down, for my traveler's insurance, and I'm waiting on clarification from this. I think I got this correct, but with all of us, health insurance is like price I may get quoted is different than you because we're different ages, we're different sex, we have different health conditions, and so on, so on, so on. All right, but the traveler insurance, like if I want to go to the U.S., I could just get insurance for 7 days or for 8 days. So I did an 8-day trip. All right, and again, I got to clarify these numbers. And if I made a mistake in this, I'll make a follow-up video once I know the difference. But the cheapest one is $60 a day, and this is for two people. All right, so for 8 days. Oh, and it gives me, where did I put that? Oh, hang on, I gotta get my other phone. For the coverage on that, remember, I'm not gonna get a specific coverage of what these cover individual, like they treat cancer, they treat this, treat that. FYI on the Panama insurance, cancer treatment is 100% covered once you pay the deductible. Okay, a lot of Americans get cancer, don't they? All right, let me unlock this other phone I got. Oh, hang on a second, let me just read this, I got some. Okay, I just got some clarification on this. It's not $60 a day or something like that. Hang on, I'm just looking at this. If I understand this right, I'll get clarification on this. If I get insurance for 8 days and I want a maximum coverage of $60,000, it's $168. If I want $150,000 maximum coverage, just for two people, and if we got in a car accident and we got hurt bad, it could be expensive. But it looks like it's a total of $130. And if we wanted $250,000 of coverage, the total for 8 days is $150. That's not bad. That's much cheaper than that. Getting it just for every month, right? So what I plan to do, I want to double clarify this. That's not bad at all. If I go to the U.S. for 8 days and I'm paying $150 and we got insurance up to $250,000, as long as we don't get run over by a tractor trailer and survive it where it's $1 million of care, it's pretty good, right? It's not bad, $150 or so. I'll clarify that. If I made a mistake in what I just said, I'll make another video. So anyway, that's my tentative plan. Now, in your case, where are you living at? You're gonna live in Panama. Health. There are a lot of Americans and expats that come to Panama and get no insurance. I don't want myself have no insurance at all. And then some of them go to, like, there's different hospitals in Panama. They have public hospitals, they have private hospitals. Private hospitals are typically better. Public hospitals are not as good. Now, if they're dirt poor Americans living on Social Security, they got to go to the public hospital. They don't have insurance. They'll still get care. It'll be okay care, but it might not be quite as good as the private hospital. Okay, so I like to get insurance that will cover worst case scenario. If I can pay $476 a year for 2 people for this coming year, and we're covered in case we have a car accident or in case we develop some disease. Say we get cancer, we're 100% covered if we get cancer. Hopefully we won't get cancer. All right, so I can't tell you specific information for you because that's the thing about health insurance. It's not standardized health care, so we all could have different prices when we go to get it. We're all different, okay? But it's something you got to think about. It's something you got to look into as you get closer to early retirement. Now, with that being said, I am retired military, but not active duty military. I retired from the reserves. I did almost 10 years active, rest of my time in the reserves. So when I turned 60, that's only a couple years away, I believe, entitled to military health insurance, which is TRICARE. So at that point in time, because people use TRICARE here in Panama, if I'm still in Panama, or if I'm in the US or somewhere else, I will probably use TRICARE as my extreme if something bad happens. If I'm in Panama, then that'll probably just be my insurance, TRICARE. So we'll cut out my expense, and then we cut these rates in half or whatever we cut them down to. And then as I get older, if we stay here in Panama, we got other options. Like once we get, what is this? I'm not an expert on this. Once we turn 65, I think it's 65 or 63, Medicare, right? Medicaid, Medicare, I think it's Medicare. We can get that from the United States. And it's one of the plans under Medicare you can get, and it can be used here in Panama. Hospitals and doctors will accept it. That's another option if we stay in Panama and we are still here when we're in our mid-60s, okay? But you got to look at your specific situation. Where do you live at? All right, what state do you live in? What country do you live in? What does your country offer? If you're in the United States of America, there's 50 states. Every single state might be different. One state might be better than another. One state's more expensive than another. You got to look at your own personal situation. Do you have any pre-existing conditions? That sort of thing. They even say, like, say if you had COVID before, that's a pre-existing condition because COVID, there's long COVID. There's side effects to having COVID. So if you had COVID before and were diagnosed with it, you have to disclose that, and maybe the insurance, I think in Panama, I think they say if you have a pre-existing condition, you got to wait 2 years before they will offer coverage for it with your insurance. I don't have any pre-existing conditions. The Miss and I, to our knowledge, we've never had COVID, we've never had cancer, we never had nothing. I've had some moles cut off, but I've never, they've been benign. Okay, I've had colonoscopy and polyps snipped out, but they were benign. So I've never had anything. All right, so no pre-existing conditions. We try to stay healthy. All right, so that being said, it's getting a little long. For my background here, what do you think? A background like this, just sitting in my recliner. That's a Coast Guard blanket type thing on my recliner. Back porch, front porch. You're me walking on the beach. Do you really not care? You just want me to talk about a topic that's relevant to investing and early retiring and that sort of thing? Let me know in the comments below. Thanks so much for watching. Please click subscribe. Tell others about this video if you think it's worthwhile, or don't tell them if it's not worthwhile. So that being said, have a great day. Mazske signing out.